At the 13th BGICC 2021, I will be discussing surveillance in women who have had breast cancer. It is a very important topic to discuss, especially with the increasing incidence of breast cancer across the world, as well as increased utilization of adjuvant treatments, which has led to longevity and increase in the life expectancy of these women, which means these women will be available for further imaging tests and making sure that they are safe for the rest of their lives and remain cancer free. So, survivors are at increased risk of developing a second breast cancer than an average risk or general population. We know that there is risk of local recurrence, there is risk of developing another cancer in the same breast or the contralateral breast. And if that occurs, sometimes there may be distant metastasis. So it is important that these women remain under imaging surveillance in order to improve not only their survival, but also the quality of their life. In this particular talk, we will be going through briefly what are the NCCN guidelines for surveillance of these women who have been treated successfully for breast cancer. We will also go through a few ASCO guidelines to come up with an overall understanding of what would be the most appropriate way of looking at these women and seeing them in our breast imaging departments. There are many different scenarios which will be available based on what kind of treatment the women choose or the women get. Also, whether these women are average risk women or high risk women, because the type of surgery may vary. For example, in a high risk woman, the woman may choose to have a mastectomy, or she may choose to have a contralateral prophylactic mastectomy. So there are many different considerations in this in how we need to look at these women. So the first scenario obviously is breast conservation treatment, wherein the native breast is still present and the patient has received some adjuvant treatments as well. So how would we follow these women up? Then how would we follow women who have had unilateral mastectomy? Do we really need to do something about it? And then of course bilateral mastectomy. And then there are different types of mastectomies that are being offered now. Was it a nipple sparing mastectomy? Is it a skin sparing mastectomy? And what kind of augmentation or reconstruction has been performed after the mastectomy? So all these factors are going to really determine how we are going to follow these women and make sure that we detect any new cancers at an early stage. So, if we just can summarize what the current recommendations are, generally it is recommended that any woman who does have native breast left in the form of breast conservation or a unilateral mastectomy, these women should undergo annual surveillance with mammography. There is no evidence that breast MRI should be offered to these women as a routine test unless there is some specific risk factor, such as these women are high risk women, like BRCA gene mutation, lifetime risk more than 25%, or they have a history of mantle radiation. So, specific high risk situations are the only times when MRI should be offered routinely for surveillance. Otherwise, an annual mammography would be the most appropriate test period. There is also evidence to suggest that women with dense breast tissue, according to the American College of Radiology recommendations, women with dense breast tissue and a personal history of breast cancer certainly benefit from utilization of MRI if it is available. There are many situations or places where this kind of MR facility may not be available, such as in Canada, we are not able to offer breast MRI for women with dense breast tissue. So it all depends really on the availability. But most importantly, annual surveillance mammogram should be performed for any woman who has had breast cancer treatment and does have some native breast tissue left back. In a woman with a mastectomy with no reconstruction, there really doesn't have any indication. There's no need to perform any kind of imaging on a flat chest wall, any tumor that develops will be immediately palpable. So clinical exam is the exam of choice on the mastectomy site that has received no reconstruction. Women who receive autologous reconstruction, there is not enough evidence that these women should be screened routinely. And it really depends on the local understanding or local protocols as to how you want to follow these women with ipsilateral, or bilateral reconstruction, particularly those with autologous reconstruction. So there are many different considerations and scenarios that we need to look at. And I'm hoping that through this talk we can come up with a proper algorithm of how women with breast cancer treatment should be followed for the rest of their lives. Thank you.